This is designed to reach the providers in Mississippi, in the state of Mississippi. And we're going to break this presentation down by starting off with who's involved. Dr. Amanda Wilson, who's an orthodontist, Straight Smile Solution, and she is out of Honolulu, Hawaii. She's going to talk to you a little bit about the overview of what this treatment can do for children. And then you're going to hear from Jan Palmer and company. Jan is a specialist, and she works with insurance reimbursement, Mississippi CAN, and Medicaid. The person that you see in the upper right-hand corner, you may say, well, that's an unusual bio picture. But I want you to understand it's not unusual, not when you're talking about HealthyStart and Ortho-Tain, because every one of us typically has come to find out about this treatment and this company because of something that has touched their heart. What this has done for Jason's daughter is the story he happens to be telling when I got this picture of him in front of a room when we were doing one of our lectures. So a little bit about our company. I say world changer, and who could argue that? Dr. Earl Bergerson is a board-certified orthodontist who started out 50 years ago. We will celebrate his career and his profession, and we'll get to how that might touch you at the end of this webinar. But in 1967, he founded Ortho-Tain, and then he started to develop a system that you're going to learn about tonight. He has treated 3.5 million children around the world. He also taught at Northwestern Dental School for 25 years. For 37 years, he had a private orthodontic practice. His product and his treatment is in 37 countries now. He is regarded as the most prolific developer of patents in the world since Thomas Edison, according to our patent attorney. He holds 514 US and international patents. He has 80 monographs. He's been published 80 times. He has delivered over 500 seminars around the world. The product that you're going to hear about is an FDA approved, Health Canada certified, which means basically the equivalent of a class 2 medical device. There are no BPAs, there's no silicone, there's no latex. Everything is antimicrobial. You'll see that it is ISO certified, and ours is a product that was made in the United States. So now, if you would, I would like to hand everything over so that you're going to get a 30,000-foot view, a very captivating look at what you can do for children. As I said, we were all brought to this by very personal stories. In my case, it was my grandchildren. When I saw this company, I couldn't imagine the next 5 years not being a situation in Mississippi. Picture yourself there and tell me you would want to be anywhere but with us. So I'd like to hand it over to Dr. Amanda Wilson to give us that very special look at what Dr. Earl Bergerson has created in the system called HealthyStart.
Thank you so much, Kathy, for that excellent introduction. Hello, Mississippi. I'm really excited today to introduce HealthyStart Appliance System to you and to explain to you a little bit more about how you can incorporate Interceptive orthodontics into your treatment plans, how you can be a provider for Interceptive orthodontics. And I'm very excited. After I'm done speaking, I'll be passing this over to Jan Palmer, and she'll explain a little bit more about how you can bill medical insurance for this treatment. And what a great way to increase treatment acceptance, to increase case acceptance amongst your community than to have the ability to bill medical insurance. So that's incredibly valuable information, and hang in here. It's going to be about an hour to an hour and 15 minutes today. I'll probably take about 35 or 40 minutes, and then we'll pass on to Jan. Make sure you stay in past Jan, because Kathy has an excellent opportunity and an excellent offer for you just for the doctors on this presentation today, on today's webinar, for you to incorporate into your practice. So make sure you stay in. All right, so let's go ahead and get started, and I'm going to explain to you a little bit more about HealthyStart and who I am. Like I said, I'm Dr. Amanda Wilson. I practiced for 10 years in Northern California. Right now I live in Hawaii with my family. Those are my 2 kids, Evan and Olivia, and they are the center of my world. I'm sure you have kids that are the center of your world. I'm super excited to explain to you this orthodontic system. It's totally different than what else is out there in our community today. So I know the first thing you're going to want to do is go to your orthodontist down the street, and you're going to say, hey, I went to this webinar today. What do y'all think about this? What do you think about this system? And your orthodontist is probably going to say, I've never heard of that. Is that Ortho-Tain? It doesn't work. Well, I can tell you this. I went to a great dental school, UCSF, a great orthodontic school. I know a lot of people down in Mississippi, and I can tell you there's no orthodontist that I can't explain the system to, show the research, and explain to them how it's different from the other systems out there. Right now, what do we have available for our patients out there, especially our kid patients, our pedo patients for ortho? Well, you know what we have. We basically have two options. It's going to be traditional braces, and you know the limitations of braces, right? So you can't put them on mostly till the patient's older, they collect plaque, you have perio problems, you have decalcification, they're uncomfortable, they're painful, food restrictions. Patients don't want that. They just think that's all that's available. What's the other option? Sure, we've got Invisalign and all the different aligner companies out there. There's about 12 to 14 aligner companies out there now that Invisalign patents are lining up. So, you know, what's the limitations of this? Well, there's biomechanical limitations, of course, and also the brand names are expensive, and most patients, they know they can't afford that. It's not an option. And, you know, things are going to change a little bit in the upcoming years, but right now that may not be an option for your practice. So let's talk about the third option, and that is HealthyStart. So most people haven't heard of HealthyStart in the US, but I'm telling you, all around the world, in some countries, it's the #1 orthodontic system out there. Now, countries like all over Europe, South America, they tend to gravitate, the doctors, the orthodontists gravitate more to removable and functional appliance systems instead of traditional braces. I'm not sure why the US does it the way they do, but sometimes we just get stuck in a rut and we think that's what's right. But sometimes there's other options out there. So please open your ears and open your minds to another more healthy, happy option for your patients, and an easy option for you to incorporate into your practice. And very little chair time and very little lab fees. So let's explain this to you today. And keep in mind also that patients have all different growth curves. So they age, their skeletal growth age, they have their chronological, and they have their dental age. And these things may not correlate. It's really early treatment is critical to an excellent outcome. Now, most patients and most parents, they don't want to do 2 treatments. They don't want to do phase 1 and phase 2 because it's too expensive. And their insurance may only pay once, or they may not even pay for phase 1. So parents are going to say no to that when you initially say it's going to be in 2 stages. The important stuff all in one stage for one lower fee. That's something that parents would be interested in, especially if it's a removable appliance system. So we already had the great introduction to Dr. B, Dr. Earl Bergerson. He's the inventor of the HealthyStart system. He's incredible. If you've ever had a chance to hear him, get on the HealthyStart website at thehealthystart.com, watch some of the webinars, and hear him speak. He is absolutely a fantastic inventor and a fantastic doctor. So please take a moment to learn more about him. Now, we're going to go in and talk a little bit more about the HealthyStart system. It basically has 3 components to it, and you can use whatever component works for you in terms of orthodontically. You might utilize it for habit intervention. You might utilize it for phase 1 treatment. You might utilize it for comprehensive treatment. So we'll go over that real quick today. And if you keep in mind, this is a really brushed overview of the treatment options. So please, if you have any questions, connect with us, connect with our teams. We are a US-based company out of Chicago, Illinois. So everything's US-based, from the lab to the techs to everything. So if you have any questions, and there's not many companies that can say that, please reach out to us and we'll explain it to you. All right, so we're going to start with our first step to the HealthyStart appliance system, which is habit intervention. And I'm sure you all know what habits are, right? So habits are something that's undesirable. Many kids have habits, many adults have habits. But one of the problems with tongue and finger sucking, mouth breathing to a normal tongue resting position. So that's the first stage. The HealthyStart habit corrector is going to correct mouth breathing, snoring, sleep disorder breathing, sleep deprivation. All the habits that I talked about comes in all different sizes to accommodate different types of bites and different age kids and different size mouths. And to boost, who wants to have a fixed expander, a metal fixed expander? Nobody does. They're uncomfortable, they're painful, there's food restrictions. The HealthyStart appliance system, the habit corrector, the first stage, can correct 77.4% of all cases that need arch width widening. That's amazing. And you just wear it at night. So the other thing that's great about it is if you have any patients, and we're talking about a awesome because interceptive treatment, preventing malocclusion, or correcting malocclusion, and the parent and the patient are happy. So I think it's an amazing product. Correcting malocclusions. Patients have malocclusions all the time, but what are the options out there, right? What are the options for your patients? Well, I can tell you as an orthodontist, I would see patients with severe malocclusion, 4, 5, 6, 7, and I'd say, oh, there's nothing we can do right now. We're just gonna wait till they get older and we'll do a jaw surgery. Well, that's not necessarily the only option. So let's open our horizons and let's talk about all the options out there. Now in Europe, South America, other countries around the world, they're using functional appliances to correct bites at a young age, and it works, and it retains, and they're avoiding the need for orthodontic or jaw surgery. Who wants a jaw surgery? It costs $70,000 to $80,000. Nobody wants it. Insurance may or may not cover it. Now I know Jan's gonna tell about stuff, but it's much harder to get insurance to cover a $70,000 or $80,000 surgery than it is to get them to cover an interceptive option for malocclusion. So we'll talk about that a little bit more. But what type of malocclusions can we correct? Open bites, overjets, overbites, small lower jaws, and constricted maxillas. So I have to explain a little bit more about how the HealthyStart appliance system works. So it works fundamentally totally different than regular traditional bonding systems where you stick a bracket to an erupted tooth. In this case, yes, first step is going to be eliminating all the habits, right? Establishing the correct arch width so that the teeth can come in on their own and not be crowded. Now, the other step to the system is eruptive guidance. That's where we're going to provide a channel or a guide so that the teeth come up straight to begin with, a template or a matrix per se. So that way the teeth come up straight. We all know that if teeth come up straight, they stay straight. They have memory in their PDLs and their collagenous fibers. But if teeth come up crooked, they don't stay, they stay crooked. They'll relapse, right? And when they relapse, they have memory and they'll go back to their old position. So the idea is that we're going to guide these teeth that would have been crooked straight to begin with, and then there's no relapse. And it really does work. Biomechanics, we kind of already went over this. So in terms of orthodontics, we're correcting bites, we're establishing ideal overbite and overjet, we're getting all the teeth to occlude, ideally, into intercuspate, we're providing fiber development and straight teeth for stability, and we're reducing or eliminating the future relapse due to proper alignment before adult collagenous fiber formation, and reducing the chance of orthodontic treatment later. Indications for use. We can use it for, if you start young, like 4, 5, 6, 7, when they're still kind of primary teeth or just transitioning into mixed dentition, you can use it for almost everything. Crowding of any severity, overbite of any severity, overjet of any severity, rotations of less than 90 degrees, TMD problems, maxillary spacing any severity, open bite as a result of habits, not skeletal open bite, but we'll go over that later, gummy smiles, cross bites, and sleep disordered breathing issues, and we'll get to that later. Contraindications, not too many as long as you start young. Closed lock TMJ, we've heard some controversy over it, may still work with that, but we can, right now it's a contraindication. Skeletal class 3 malocclusions, skeletal open bites, and cleft lip and palate disorders. But that's not too many cases. You're talking about probably, from my experience, 1 or 2% of patients that from age 4 to 7 you can't use it with. The vast majority you can use it with. So what if you do nothing? Well, we know that kids in primary dentition, ideally you want to see 6 millimeters of space in each arch. That's a lot of space. And a lot of times parents are saying, wow, there's a lot of space in my kid's arch, they're going to have gaps. Well, no, that's the ideal amount of space to provide enough space so the teeth come in nice and straight, the permanent teeth. Now, what if they have cracks? Or if there's habits, we're going to start early, as young as age 2. We even had one patient that was young as 18 months. It's very easy, not painful, not uncomfortable, nighttime only solution with excellent compliance. And we can teach you all about how to incorporate that. Otherwise, if there's no malocclusions, no habits, you'll go ahead and start when the child has their first wiggly teeth. So very easy, very simple to start. Here's some of the appliances. Keep in mind when you submit a case, it's pretty similar to submitting a case with Invisalign. You're going to submit your photos, your pano. In some cases, you might submit a Ceph. And depending on the age of the patient, you might submit a scan or a model. So don't stress about that. We can tell you about that later. And then a treatment plan is generated by our team. And the treatment plan will have different appliances that are prescribed to the patient per recommendations to help correct their habits, their malocclusions, and to straighten their teeth as needed. So they will give a treatment plan for you. We will go over this if you do decide to become a provider in our HealthyStart certification course. Right now, there's 2 options for that, and we'll touch on those at the end. So crowding, let's see some cases now. Here's just some crowding solutions here, okay? You can see how nicely it straightens teeth. Keep in mind, in most cases, we're just wearing the appliance at night. Occasionally, it's an hour or 2 during the day, but it's a special circumstance. Here's some spacing cases, nice outcome. Overbite, fantastic outcome. Overbite times you have to wear it 1 or 2 hours during the day. Class 3, excellent outcome. Open bite, but not skeletal open bite, very, very easy to eliminate with a functional appliance system. Cross bites, no need for a fixed cross bite system. Very simple, very comfortable, nighttime only. Here's some outcomes here, crowding corrections. You can go ahead and see how nicely this eliminates crowding. Overbite corrections. Overjet corrections. And let's go ahead and dive into some real cases. Now, I know I'm flying through this really fast, but I know you're going to want to hear what Jan Palmer has to say. It's late at night. You want to have your beverage to go to sleep, so we're going to fly through this really fast. But if you go to thehealthystart.com, click on provider, click on cases, click on research, everything's in there that we're seeing today. And remember, you can connect with us at info@thehealthystart.com if you have any additional questions. And I personally would be glad to talk to you if you have any questions. Just let us know, and they'll connect me to you. So here's a great case, okay? This is a patient that came in at age 8, had a severe overjet. If I had seen this patient as an orthodontist, I would have said, gosh, we're gonna have to pull buys when they get older. We're gonna have to do surgery. Well, not the case. We use a functional appliance system for basically only every night for about a year. And look how nicely the jaw grew. Look how straight the teeth got. Look how nicely the diastema is closed. Case number 2, started a little bit younger. It's a female. So sometimes you have to start younger in females. Same thing, overjet case, fantastic outcome. There's no orthodontist that couldn't take a look at this case post-retention. Keep in mind, this patient is wearing no retainers and say that they could do better because they can't. It's perfect. All right, so we've been talking about straightening teeth. We've been talking about habits. We've been talking about stage 1. We've been talking about comprehensive. I know you understand all that. Now we're going to dive into something you probably have never heard about. This may or may not be interesting to you, but I think it will be interesting to you when you find out the benefits and the outcomes that you can have in total body health and in airway. And I know all of you are interested in sleep dentistry. It's the trend of the year, basically, trend of the decade for dentistry. Well, this is sleep dentistry for kids. Now, sleep dentistry for kids we call sleep disordered breathing. It's something a little bit different because the jaws are growing. We can intercede a little bit more. So it's a slightly different outcome. So let's talk a little bit about medical insurance for, and Jan will explain that a little bit more to you. We are improving total body health, improving airway, and improving sleep disordered breathing. You can bill orthodontic insurance too, but dental insurance, but you have many options to fit the patient and their finance needs. So how do most orthodontists diagnose and treatment plan airway disorders in children? Well, most don't. And if you're like me, you maybe looked at tonsils and adenoids, TNAs, and referred them to ENT, and that was pretty much what you did. Or you might have looked at tongue thrust and myofunctional issues and prescribed some exercises, but really you didn't dive deeply into improving the patient's airway. As a matter of fact, most orthodontists, honestly, they're compromising the airway because they're pulling teeth, the average orthodontist in the US. And pulling teeth closes the actual volume of the mouth so that the tongue isn't accommodated as easily. And there's not enough space and it sits in the wrong position. So actually we're compromising the airway. So let's talk about some other options. Now remember, HealthyStart, just to give a little plug, is growing the healthiest children 3.5 million smiles to date. So I think that's incredible. I like to say that HealthyStart is kind of like, it makes a child blossom and grow just like this tree here. You see how two kids, one kid could be doing okay, but a kid can be doing better. And you don't even know that something's wrong with your kid until you see how much better they can be. So why not give it a shot? Okay, so we see here, there's about 22 symptoms here, okay? Just in case some of you are in your car, you're putting kids to sleep, you're doing dishes, and you can't see the slide, I'm gonna go ahead and read off quickly this list of symptoms because these are not healthy symptoms. These are symptoms you do not want your kids or your patients to have. Now, I know you're thinking, what the heck is she talking about? What does this have to do with orthodontics? Well, it totally does, because all these symptoms are related to dentistry. All these symptoms are related to orthodontics, and specifically, all these symptoms are related to malocclusion. So why and how? We'll explain a little bit more in a few minutes. So here we go. We got ADD, ADHD, bedwetting, difficulty in school, mouth breathing, snoring, restless sleep, delayed or stunted growth, nightmares, irritability and anger, morning headaches, chronic allergies, eczema and asthma, depression, tooth grinding, swollen adenoids and tonsils, aggressive behavior, daytime drowsiness, peer problems, limited friends, waking up at night, sleep talking, and sleepwalking. 9 out of 10 kids suffer from one of these symptoms, and I'm sure you know kids like it. But what if you didn't have to suffer from these symptoms? What if these symptoms were related to your malocclusion, your airway, or your orthodontic condition? Well, sometimes it is. And sometimes even the pediatricians don't know. So what's the root cause of these symptoms? Well, the root cause, and research shows, is often sleep disordered breathing and sleep deprivation. And this, like I said, can be related to their orthodontic malocclusion. So we're going to go ahead and dig into the slide. This is probably the most important slide of the day. And I'm going to try to explain it as clearly as I can. And keep in mind, when you go to the actual 2-day course, and we're going to be talking about the 2-day course, don't forget, we're having one in Mississippi. Yes, Jackson, Mississippi, we're coming to you end of August. So make sure you stay tuned. Okay, so we're starting with the average child. Average child in the U.S., parents struggling, they're going we're having more processed foods, more sugars. We're not actively developing the musculature that we used to have eating seeds and roots and nuts. So as a result, we're developing weak jaws and poor occlusions. So that's also having an effect. What about habits? Yes, thumb, finger, lip sucking, that happens too, develops malocclusions. Now, as a result, they can get a compromised airway. So we're having restricted airflow, reduced airway, problems with oxygen and CO2 transfer. This can later cause all sorts of other problems with ADD, ADHD, bedwetting, chronic allergies, nightmares, drowsiness. We listed that list of symptoms before. So we'll explain a little bit more about how that works. So first, let's talk a little bit about airway. Now, I know you guys are going, oh no, it's radiology class. But yes, it's radiology class again. You're back in dental school. Let's take a look at the airway. On the left, we have a restricted airway. On the right, we have a normal airway. Can you go ahead and see exactly where the airway is? Take a look at my pointer. See right here and see right here. So we like to use the analogy of an airway being a certain size. So on the left, we call that airway a coffee straw airway. Now, if you go to any coffee shop in town, you'll get the coffee straw. That's about the diameter of that airway on the left. What about the airway on the right? Airway on the right, we like to call it a garden hose or a smoothie straw or a Slurpee straw airway. It's a little bit bigger. It's more healthy, right? 2 average 5-year-olds, one has a small airway, one has a big airway. Okay, let's take it a step further. What about the effects of mouth breathing? So when a child breathes through their mouth, okay, whether it's due to tonsils and adenoids, due to malocclusion, whatever it's due to a stuffy nose, chronic allergies, when they breathe through their mouth, their normal airway on the left closes off and becomes a coffee straw airway on the right. This is basically what happens with sleep apnea in adults, but it can happen in kids too. We call it sleep disordered breathing. But the kids critically need oxygen. They critically need their air. They need their airway open because their airway is small to begin with, but yet they're growing and needing an incredible amount of oxygen. So if this child is not getting the right amount of oxygen due to whatever reason, their malocclusion, their allergies, their tonsils and adenoids, then this child is not developing the way they should be. They may have stunted growth. They may have bad behavior. This child may be in bed for 11, 12, 13 hours a night. I hear parents all the time saying, my child doesn't have sleep issues. She sleeps 13 hours a night. Well, it's all about the quality of the sleep, not the quantity of the sleep. So if you see your child breathing through their mouth, snoring, thrashing around in their bed, anything like that. If they're not having nice quality sleep, it's getting almost any sleep at all. They're not getting enough oxygen possibly. And that way, they're not growing the way that they should be. And you're having some of those symptoms that we talked about earlier. Sometimes these symptoms could be eliminated in just night by getting a nice quality amount of sleep. So now we've told you a ton about the HealthyStart orthodontic system, as well as the sleep disorder breathing benefits of this orthodontic system. So you're probably thinking, how do I start submitting cases? Yes, we can help you with that. We'll talk to you more about our certification course and the options at the end of this presentation. Make sure you stay on, listen to Jen Palmer's presentation about medical billing for early interceptive orthodontic cases, as well as stay on at the very end for Kathy's return and her explanation about some of the
in peds. And that's me. So we're going to get into this presentation. This presentation is for discussion and educational purposes only. It's not intended to offer or use any legal advice. All codes are owned by the ADA and the AMA. To present nationally, we would have to pay a royalty on them, so I don't generally give out codes. Thank you, HealthyStart, for having me. This is great. And Dr. Bergerson, this is a great system that you have going on here. Love it. So, question is, could HealthyStart services be covered under Mississippi Medicaid? We know in most cases HealthyStart services can be covered under orthodontic benefits and in some cases medical benefits, but we're looking basically right now, I'm going to zone in on Mississippi Medicaid. That's one of the hot topics right now that we're going to go over. In this webinar and medical insurance. So let's get started. Mississippi, as of the stats in 2015, there was 743 beneficiaries enrolled for Medicaid. There was 422,000 people enrolled in the Mississippi CAN system and almost 50,000 in the CHIP system. So this is big in the state of Mississippi, and we're lucky enough that we're going to get some coverage under orthodontics, so we might as well figure that out from the beginning. I want to go over a couple acronyms that you're going to be familiar with. When you deal with this insurance, anytime you're cross-coding with medical especially, or any of the governmental plans, you're going to get a lot of acronyms. So we're going to go over DOM is the Department of Medicaid. UMQIO is the Utilization Management and Quality Improvement Organization. They're the ones that are going to do your pre-authorizations. You have EPSDT, which is Early and Periodic Screening, Diagnosis and Treatment, and PA is your prior authorizations. So, the Department of Medicaid manages basic Medicaid, and then they have two statewide managed care programs, which I just said is Mississippi Coordinated Access Network, or Mississippi CAN, and then we have the Children's Health Insurance Program, or CHIP. And that has two organizations involved in care. You're going to see either Magnolia Health or United Healthcare Community Plan as coverage. Information you can always call. It's very important. Healthcare providers should verify their patient's eligibility plan at each date of service and make sure that the patients and their provider are a network. It's essential to receive proper reimbursement. If you don't do your due diligence and they're not covered, you're going to have a hard time collecting from the patient or the parent. So what is the difference between programs? If anybody has your phone, you can take a quick snapshot of this if you want, just so you have a better understanding of the difference between Medicaid fee-for-service, the Mississippi CAN, and the CHIP program. I'm sure that you're all very familiar being in the state. And if you're not familiar with the Medicaid program, it might be beneficial to take a look at it more in depth, especially if you're going to be a HealthyStart provider, because you can get some good benefits for your patients. So let's take a look at the basic benefits. This is right off of the Summary of Benefits for Mississippi Medicaid Providers, insurancekidsnow.gov. They will cover your panoramic x-ray every 2 years. So if the patient comes in and they're referred by another provider and they don't have a current pano, you can probably get it covered under their Medicaid benefits. And of course, they cover orthodontics and retainers. There are some rules that we're going to go over with you tonight, but there is benefits. It's really a good thing. Was really surprised because not many Medicaid programs do cover this. So this is up for public notice, and this is basically telling us that every year on July 1st, they are going to revise the reimbursement rates. They're going to take a look at it, and they're going to look at the national averages of what's out there and the state averages, and they may up the benefit a little bit. And this just says that orthodontic services are covered when prior authorization is medically necessary, and it's shown medically necessary, I should say, by the Utilization Management Department and for children under age 21. This is a basic guideline, your reference book. You might want to take this link down and get a copy of this in your office and refer to it often, because this is going to be your guidebook for all of your Mississippi Medicaid coverage for orthodontics. So Medicaid, benefits for HealthyStart application approved by the Mississippi Medicaid program. So you get that letter of approval. Don't see any patients if you're not already a provider, because you may not get coverage for that. A dental service provider's participation in Mississippi Medicaid program is entirely voluntary. You don't have to do this if you don't want to, but it's good to explore. So EPSDT, early and periodic screening, diagnosis, and treatment. Dental caps of $2,500 a year. It doesn't apply to the orthodontics. Your orthodontic covered lifetime beneficiary benefit is $4,200, which is absolutely amazing. I mean, that's an absolutely amazing benefit. I haven't seen a good benefit like that for a Medicaid program in a long time. So just make sure that you do your diligence and make sure that the patient meets all the criteria. Consultations. If the patient is referred in by another provider and you do a consultation just for the orthodontics for the HealthyStart system, you can go ahead and bill a consultation out. Just make sure that your notes prove why the patient was there and what's going on. And we'll go over notes in a couple minutes. So orthodontics, prior authorization, and treatment plans. Let's touch base on this. All orthodontic procedures must be prior authorized by the UM department. A prior authorization can be submitted either by using the automatic web-based review submission process, or you can send the radiographs and including pano, ceph, whatever you take in your office. You're going to use the diagnostic models and photographs. You have to send them all in. And a letter from the dentist must accompany the request for prior authorization. We're going to go over SOAP notes in a couple minutes too. You're going to want to make sure to include that in with your prior authorization so that you're very thorough. If the case is authorized, you're going to do a letter. If it's not authorized, you can go ahead and bill for your orthodontic records. But if it's authorized, then that's included in the treatment plan. You can't charge that separately. Everything will be reviewed by a licensed registered nurse, dental hygienist, or an orthodontist, or a maxillofacial surgeon for completeness and appropriateness. And the good thing is that within 3 calendar days or 2 business days, you're going to get an answer. So you don't have to wait very long. In many instances with the insurances, it takes up to 30 days to get an authorization. So treatment plans which meet Medicaid criteria are approved for the initial appliance and monthly visits as well. And they're going to give you all that when you get your authorization code. And then you always have to make sure that the patient is eligible for Medicaid when you see them that month. If they're not eligible, of course, you can collect directly from the parent. If the treatment plan is denied, again, you can submit for your orthodontic workup that is allowed. So, basic steps, pretty simple. Provider submits documentation, study models, radiographs to the UMQIO. They review the information, and then they authorize the services, and you can go ahead and start. It's as simple as 1, 2, 3, isn't it? Let's go over some of the criteria that you have to meet here. This is very important, especially when you're dealing with anything in the medical field. You want to make sure that you meet all those criteria. So, covered orthodontic services. Orthodontic services are restricted to Medicaid, EP, SDT eligible beneficiaries who meet certain criteria. They're all reviewed. The orthodontic provider is responsible for evaluating the attitude of the beneficiary and or guardian towards orthodontic treatment and their ability and or willingness to follow treatment instructions and meet appointments. So they're really stressing that you shouldn't start anybody if you don't think that they're going to be cooperative, because it's easier to just not start than to try to pick it up in the middle. Once you issue an appliance, they're under your care, and you want to make sure that you can keep track of them. So when a beneficiary is uncooperative for any reason, you can terminate. There are steps to follow. So they're all in that little reference book. You can go ahead and download that and keep that free. Following pre-qualifying criteria. If they have cleft lip, cleft palate, and or other craniofacial anomalies, over 9 millimeters of overjet, reverse overjet of 2 millimeters or more, extensive hypodontia with restorative implications, more than 1 tooth per quadrant, requiring pre-prosthetic orthodontics, anterior open bites greater than 4 millimeters, open anterior contact point displacement greater than 4 millimeters, individual anterior tooth cross bites with greater than a 2 millimeter discrepancy, impinging overbite with evidence of gingival or palatal trauma, and an impeded eruption of teeth, except for the third molars, of course. We're dealing with small children, due to crowding, displacement, presence of supernumerary teeth, retained primary teeth, and any pathological cause, unless extraction of displaced teeth or adjacent teeth requiring no orthodontic treatment would be more expedient. So you want to make sure, like I said, download that book. Make sure that when you do your notes, you look at everything here to see what guidelines the child falls in, and then you're going to make sure that you include that in your notes so that when you submit that for authorization, it's all there and you won't have any trouble. So, phase 1, orthodontic treatment. This is allowed where early intervention could result in no further need for future treatment for comprehensive therapy, which is good. They want to make sure that we catch the kids early, which is one of the things that HealthyStart is really good at doing. They have, the system is really good at intervening, and hopefully the kids won't need ortho when they get older if we start at the right time. So the first phase, or your mixed dentition treatment, is allowed in cases where early intervention could result in no further need or reduced need for later comprehensive appliance therapy. The fee for this treatment will be based upon the complexity of the condition and is determined by the orthodontic consultant. The fee for the first phase of treatment will not be more than 1/2 of the maximum, so they wouldn't pay more than $2,100 for phase 1. It should be remembered that fees awarded for the first phase will come off of their lifetime maximum. The orthodontic consultants will review submitted cases in the context of the treatment and the needed criteria. All cases may not require full orthodontic treatment to achieve the desired result, thereby allowing for partial treatment at a reduced fee. It doesn't mean you can't treat them, it just means that they're not going to pay for it all. If phase 2 isn't going to be covered, or all of your services aren't going to be covered, and it's been denied by Medicaid, if you decide for the patient to pay out of pocket, or the parent, that would be up to your discretion. So if a beneficiary does not meet the pre-qualifying criteria, providers are encouraged to counsel the beneficiary and their family prior to submitting records to the UM department. A beneficiary with a pre-qualifying condition, I'm sorry, that's Siri. I must be talking too much. If a beneficiary doesn't meet the pre-qualifying criteria, providers are encouraged to counsel the beneficiary prior to the submitting the records, and they may not display sufficient need to have orthodontic services covered by Medicaid if a pre-qualifying condition is not readily available. So you have to submit your adequate records for review and detailed course of treatment. So again, your notes are so important. I can't stress that enough, especially if you're going to get more into the dental sleep medicine. You want to make sure you start off right with good soap notes. Let's take a look at that. All professionals and institutional providers participating in the Medicaid program are required to maintain records that disclose services rendered and billed under the program, and open requests make such records available upon request. They may not ask for your records every month, but they have the right to audit you at any time, whenever they want, so make sure that everything is there and available for them. Providers must maintain proper and complete documentation for 5 years. You're going to do that anyways, I'm sure. The Department of Medicaid and their fiscal agent have the authority to request any beneficiary records at any time. Again, they can spot audit you as they want. If your documentation isn't right, they're going to look further into other cases that they've been paying for, and it's going to slow down your payments a lot. So make sure you document. A dental provider who knowingly or willfully makes or causes to be made false statement or representation of a material fact in any application for Medicaid benefits or Medicaid payments may be prosecuted under federal and state criminal laws. This is the False Claim Act that's going on. This is CMS mandated. Anybody in the chain of command here, from the dentist on down to the person that submits the claim, if they submit it willingly, knowing that it isn't a correct claim or it shouldn't be submitted, they can prosecute anybody in the office like that. So always make sure, again, your records, and we only truthfully bill what we did. So let's look at orthodontic procedures. Where do you send your diagnostic models? Wood Drive, Suite 300, Jackson, Mississippi, 39206. You can just send your case in there. They do have a place online that you can submit things also. You can sign into their portal. So, filing claims. Medicaid claims for all services that require authorization. Prior authorization prior to billing must include a TAN number, and the TAN is and everything. So just make sure that you put that authorization number on your form. You want to build a claim with codes or tooth services quadrant numbers that do not match the authorization. Well, if you don't do that correctly, they're also going to submit or deny that claim. So you all know how to fill out a dental claim form, and I'm sure most of you are pretty familiar with orthodontic claim filing, so it goes right in suit with that. Dental benefit limit, the annual limit is $2,500 per year if you're a Medicaid provider, but it says down here your orthodontic benefit for lifetime is $4,200, which is great. Additional dental service in excess of the $4,200 lifetime limit may be covered with prior approval from the department. So if you've done your full case and you still have to do some more, you might be able to get some more benefits. Occlusal guards, these are covered service. It's limited to the EPSDT eligible beneficiaries. Authorization, again, is required. If you have a bruxer, somebody that's grinding or bruxing, and you want to give them a habit corrector, you may be able to get it covered as an occlusal guide. Replacement of retainer. This is a good one. This is a rare benefit. Beneficiaries who have received prior orthodontic procedures are eligible for the replacement of a lost, stolen, or broken retainer once per lifetime, including both arches if necessary. Documentation, including but not limited to how the original appliance was lost, stolen, or broken, must be submitted to obtain prior authorization from the department. So that's a good thing. Sometimes children lose things. You want to make sure that you can have it replaced. And I can't stress enough, if it's not documented in the permanent medical record, it didn't happen. It can't support service if it's not documented. So make sure you document. This is a lot different than documenting your dental claims. Basic format you're going to use anytime you're doing HealthyStart or sleep appliances in adults, you're going to use your basic SOAP note format. This is a basic standard medical note format. Your S is for the subjective. What is the patient's chief complaint? What is the purpose of the visit? What are the expectations and their referral origin? Your objective is results of the exam, past treatment, if any, for the history of present illness, and any pertinent dental or oral findings. Your assessment is A, your diagnosis, the level of the disease, any associated conditions, complicating factors, and prognosis. And then your P is your plan of care or your explanation of care that is planned, what the next visit will be, and long-term follow-up. You can do 4 basic paragraphs. Paragraph 1 is your subjective. Your objective is your second paragraph. Assessment is your third, and your plan is your fourth. It's not that complicated. They are a little bit time consuming. Once you get templates made up, it makes it much easier. There are companies out there that can help you with that too. So always use your SOAP note format when you're treating HealthyStart children. It will help you in the long run. I'm going to talk a little bit about coding. Like I said before, I'm not going to give you the actual codes. I'm sure you all have them in your office. So we have different coding. Limited orthodontic treatment. There's your first set. This is orthodontic treatment with limited objective, not involving the entire dentition. It may be directed at the only existing problem or at the aspect of a larger problem in which the decision is made to defer or forego more comprehensive therapy. So this includes your limited orthodontic treatment of the primary dentition, your limited orthodontic treatment of the transitional dentition, limited orthodontic treatment of adolescent dentitions, and limited orthodontic. Go on to interceptive orthodontic treatment. And this treatment is using codes for interceptive orthodontic treatment, and these are for procedures to lessen the severity or future effects of malformation and to eliminate its cause. An extension of preventative orthodontics that may include localized tooth movement, such treatment may occur in the primary or transitional dentition and may include such procedures as the redirection of atopically erupting teeth, correction of isolated dental crossbite, or recovery of recent minor space loss where overall space is adequate. So the key to successful interception is to intervene at the incipient stages of developing problem to lessen the severity of the malformation and to eliminate its cause. So we're going to use the codes for either interceptive orthodontic treatment of the primary dentition or interceptive orthodontic treatment of the transitional dentition. Then we have our comprehensive orthodontic treatment. These are multiple phases of treatment, and these codes should be used when there are multiple phases of treatment to provide at different stages. For example, the use of an activator is generally stage 1 of a 2-stage treatment, but in this situation, placement of fixed appliance will generally be stage 2 of a stage 2 treatment. Both phases should be listed as comprehensive treatment, modified by the appropriate stage of dental development. So you want to use these codes to report the coordinated diagnosis and treatment leading to the improvement of a patient's craniofacial dysfunction and dentofacial deformities. So for comprehensive, we're going to use the comprehensive orthodontic treatment of transitional dentition, comprehensive orthodontic treatment to the adolescent dentition, and comprehensive orthodontic treatment of the adult dentition. You'll have those codes in your office too, I'm sure. If not, we can, I'll give you my information later. If you need anything, you can shoot me an email if it's a simple question, not a problem. Minor treatment to control harmful habits. Now, this is a good one to know because with HealthyStart, this is something that we will start with the habit corrector. You may be able to get these covered under the orthodontic treatment. And these are removable appliance therapy or fixed appliance therapy for tongue thrusting, thumb sucking, habits like that. So we want to make sure that we can correct those habits. So I hope I haven't confused you too much. I want to give you a few things here. Few things you have for help. You can choose to either outsource your cases to check benefits, file claims, assist on pre-authorization. I know somebody, her name is Kim. She's Kim at Dental Medical Billing. They do a really nice job with things. They're very ethical and everything, so I do recommend them. If you go to links to success.biz, they have some online courses that may help you a little bit more. They're going to have medical billing services available, and they also have a book that you can purchase, and soon the school will be open, and that'll be good. Kim's number is 518-954-0527. Tell her you're a HealthyStart provider. You will get a discount when you sign up with them. And that's my email is jan@dentmedins.com for dental medical insurance crossing. Just make sure you put HealthyStart in the, in the subject line. Thank you. I wanted to say a special, remind you of a special incentive. If you attend the big event coming soon in Mississippi, and right now I'm going to pass this back to Kathy to recap that. Thank you very much.
Thank you, Jan. Just outstanding. As always, we have the really high caliber team, a dream team of people who bring their expertise and share with the professionals that we reach and want to be a part of our providers. If you joined our presentation a little bit late, let me share with you a couple of kind of what I might call the highlights of what you've learned about. And what you've been learning about is HealthyStart, the Ortho-Tain company that provides for children the kind of care that can truly change their life. 9 out of 10 children have at least one symptom that can be addressed efficiently but at a very young age by HealthyStart. The future is bright, and I'll tell you that no parent ever sees this and doesn't get the logic of this whole how and why and the cause and effect. And they get it, and they want to get it for their children. So what you've been learning about tonight is that the HealthyStart program stands alone. There's absolutely nothing that compares to this program. We want to start early. We're going to change their future forever. We've got 50 years of science and research behind it. You had a presentation tonight from an orthodontist, the outstanding Dr. Amanda Wilson, and she sometimes will do a presentation on exactly why this is so wise, not only to do, but for orthodontists in particular to do. It's a comprehensive treatment. We fix it. This isn't something that's a Band-Aid or that is marginal or addresses one thing. It simultaneously addresses everything. The results are permanent, so it's not a Band-Aid. You can feel so good about what you're doing. There's nothing pharmaceutical here. It's pain-free. It is a much lower cost for not only the parents and the family, but in this case, maybe even to say the government or the state. It is a great gift that you would be able to offer your young patients, but it's also a great gift to you as a professional. When I was listening to Jan talk about this, it's complex. It's a little bit outside of the realm of my and scope of my life. But when I hear her say that this is such a great benefit, she hasn't seen anything like this in a long time, lifetime benefit of $4,200, and it's doing something that is so needed. So with that in mind, you're going to hear the next important real information to impact your life. This is exclusive to you, and this is 2 parts. This is the big picture, and then there's the specific in your backyard picture that's on the next slide. But our founder, that is Dr. Earl Bergerson, who's created all of this, who's the most prolific patent developer since Thomas Edison, he is being honored later this summer. So he is still lecturing. He is still speaking. Who would not want to learn from the man who's the inventor? Who wouldn't want to be able to say to all their patients, oh yeah, see, I actually learned this directly from him. Well, on August 3rd, 4th, and 5th, we're going to be in Chicago, and there will be a lecture that he will participate in and conduct, and we will probably have at least 10 other of our top-notch doctors, some of them from around the world, that will be doing presentation. Normally, any one of our 2-day lectures are $3,400, and and that includes for you, the doctor, and for 4 members of your team, because it's smart to bring your team, your front office, your hygienist, your assistant. The people who you want to work in a flow with need to be on the same page so that they bring home the same message and have the same vision, can identify these problems in children. So what we've done because of this very special occasion is that we're allowing for the people who have been on this webinar tonight to not at $3,400, but at $1,700 attend this really special once in a lifetime event for Dr. Earl Bergerson. It's going to be in Chicago, Northwestern School of Law. Remember that he taught at Northwestern Dental School for 25 years, so the alumni is stepping out to really pay tribute to a man who has changed the world with what he has done. If you cannot make it to that because you were with us for this webinar, we would also like to extend to you $500 reduced price for your becoming a certified and trained provider. That can happen in a number of ways. We are coming to Jackson, so we will have that event, but you could also do it online if you wanted to start early and then just come to the event. That's completely available to you. Or we have events that maybe tie into some of your other travel or convenience or family. We have one coming up in a couple of weeks in Austin, Texas. Dr. Wilson, who you just heard from, will be providing information there, as well as in the Dallas area at the in August 18th and 19th. So we have until the 23rd, that is a week basically, for you to register. How are you going to do that? What's the next step? Help me out. Make it simple. Okay, you can either call 844-KID-HEALTHY. They'll help you over the phone. They'll get you registered. They'll walk you through it. You could go to thehealthystart.com and you will see that we have an events calendar. And on that, you will see that this is one of our opportunities for you to attend a lecture. You could also send an email to Susie at HealthyStartChild.com. Susie is running the show, by the way. She's behind the scenes at all of our webinars, so she does a lot of our technical and social media. When you're a part of this company, you are joined like this with us. We're brainstorming, we're working, we are in unison, we work in a rhythm to help get every child the opportunity to have this before the problems go on. Because if we don't get it taken care of, they've got Band-Aids and they've got a miserable life with these things that just continue to dog them into their future. We've got to fix it when they're young. So now let's talk about, and again, I'll recap, for 1/2 the normal price, please join us in Chicago. It'll be the biggest event that we'll have, and it honors the founder and this man who's changed the world. Now let's talk about what's happening in your backyard. At this time next week, I'll be on a plane back from Jackson because I'm coming in Tuesday night. On Wednesday morning, I guess we go to Hattiesburg, and then on Wednesday night, well, you're invited. It's kind of a nice little overview again and party to kind of get to know everybody. That's going to be Wednesday night, and then Wednesday afternoon we'll be speaking with a group of pediatricians because we're working with a lot of different doctors, ENTs, pediatric sleep specialists, pediatricians, chiropractors, general practice doctors, family doctors, the dentist, and the orthodontist. And you're all working together because families are coming in with children with these issues and you're all looking for answers. So what we see developing are dream teams of people who are coming together who have this solution. And that's what we are. We are a comprehensive solution. And the person that really kind of brought this together is a man named Taboris Fisher. And I assume a lot of you will know Taboris. And we're so appreciative of the fact that he has not only brought us into your homes and businesses tonight, but he's bringing us into Jackson next week. So on Wednesday evening, we're going to be meeting at the Patterson facility, their branch office, and you can see that the address is 104 Cross Park Drive on Pearl. And we're going to open the doors at 6 o'clock. Meet and greet, get to know everybody. At 6:30 sharp, we're going to have a presentation. We're there for a very serious impart of information. We'll have pizza, we'll have sandwiches, something, because it's the dinner out. We want to feed you. But if you would please do me this favor, jot down that phone number. That's my cell phone. And if you send me a text, I will say how many people are planning to be with us. and we will get a head count so that we are prepared for you. So the special invitation goes out to you tonight for that. But again, because you've been a part of this, we have another presentation that is a full 2-day overview for certification happening, a lecture, August 25th and 26th. So look at all these things that are happening. Like there's something meant to be right here in your backyard in Mississippi. Again, because of the program that the state and the government has made available to those people who live there, for those of you who work there, it is a perfect opportunity. And I will tell you this, it changes lives. And if we were able to penetrate that community with a lot of children being helped, we would start to see the impact. We would start to see their performance in school, and children who are on medication, and children who are having trouble sleeping, and all of the dozens of things that Dr. Wilson went over that are the symptoms of sleep disordered breathing. We would be taking, such a direct hit on those maladies and those problems for those children. It would change their lives, and you would have referrals from parents, because parents line up for the best options for their children, for their health, and for their future. So I'm going to just recap by saying thank you to everybody for being with us. Thank you for Dr. Amanda Wilson. Thank you for Jan Palmer, because her expertise, she is at the absolute top of the food chain. And believe me, when it is in this industry and people who are looking for this kind of help, there are people who have a reputation for knowing their stuff, but nobody like Jan Palmer. So that's why we have her on our team and brought her to you tonight. Remember, next week, Wednesday night, we're going to be there at the Patterson group. We're going to have our own Taboris Fisher and Jason Gooden, who is our Director of Integration. We help you integrate into our system to help your patients. And again, my phone number is children. So with that, I thank you, Jan Palmer. I thank Dr. Amanda Wilson and Susie Lafredo, again, who is driving the bus technically. I'm Kathy Turner, and we look forward. Good night, all.